Physical activity and its role in diabetes management, presented by Victoria Leon. This project was curated by Julia Lamparski, Victoria Leon, Ingrid Longoria, Jennifer Lopez Fernandez, Perla Luna, and Isabel Lyons. Clinical scenario. Suzanne is a 34-year-old African American woman. She is currently overweight and does not adhere to an exercise regimen or a healthy diet. She has a family history of high blood pressure, and her grandmother has developed type 2 diabetes at the age of 56, and her mother is pre-diabetic. For multiple generations, her family has lived in a food desert and did not have adequate education concerning how to live a healthy and sustainable lifestyle. Now, let's go over some background information. Type 2 diabetes, also referred to as diabetes mellitus, results from the overconsumption of sugar and modern lifestyle choices. As a result, the body does not produce enough insulin needed for blood sugar regulation. Some risk factors include obesity, inactivity, increasing age, and family history. Native Americans are at the highest risk, followed by African Americans, then Hispanics. Urbanization and genetics are predisposing factors. Epidemiology. Diabetes is the seventh leading cause of death in the U.S., making up 12% of all deaths, and about half of these deaths occur in people under 60 years of age. Figure 1 shows the relationship between incidence and prevalence in diabetes from 1980 to 2015, and the largest increase in incidence and prevalence in diabetes over the 35-year time span. Incidence is the rate of people that develop diabetes during the time frame, whereas prevalence describes the distribution of diabetes in the U.S. population that already has diabetes during that time period, which include new and pre-existing cases. They are directly related, and when incidence increases, prevalence tends to follow. Type 2 diabetes is diagnosed with a simple glycated hemoglobin test or similar blood sugar tests, and there are routine screenings for all adults age 45 and over. So how is type 2 diabetes managed? It's really important to create the correct approach to the patient because each individual is different and management has a lot to do with tailoring it to their specific needs. The most common management strategy is blood sugar monitoring. On the right, the images show a regular blood sugar test machine. With just a prick of the finger, sugar readings come in 15 seconds or less. Additionally, healthy eating is important for managing diabetes. Typically, scheduled eating in small portions are recommended. Additionally, registered dietitians are also recommended to aid in developing new habits and creating barriers. Exercise is also very, very important. Regular exercise is recommended to help lower blood sugar and maintain a healthy weight. Typically, aerobic and resistance exercises are desired most. Lastly, diabetes and insulin therapy is used when a patient cannot maintain blood sugar level with the above listed options. So our plan for Suzanne is trying to motivate her to take action to manage her blood glucose levels, getting her to consistently engage in physical activity and be more conscious of how she fuels her body. We use the social cognitive theory to encourage behavior change and promote self-efficacy. A study conducted showed that intervention based on social cognitive theory has a positive effect on diabetes self-care in patients. Giving Suzanne the correct tools so she knows she can manage her health is very important, and helping her create small behavior changes that make a difference. Nudging will promote behavior change through environmental or social norms. This allows us to encourage Suzanne to take the stairs instead of the elevator when the option is presented. We also use the social ecological model to provide guidance on successful programs that focus on different levels of influence. The multiple levels of influence will help the patient stay motivated and successful in her behavior change. First, she would need to be educated on her disease and the benefits of exercise that has on diabetes, as well as set small goals. The second part of this could be the influence of her interpersonal group, such as family and friends who can keep her accountable. Community is also a huge part, so joining a gym could benefit her, as a community of people all doing the same thing could be a huge motivator. Studies show that these three levels of influence are the most important and can be the most beneficial. When it, when it comes to making lifestyle changes, it is easy to run into issues or fail, so it's important to make sure that goals are attainable and that there is a support system. Our plans help make sure this happens by implementing interventions and small goals to make sure our patient has the best possible chance of success. Our plan can best be implemented into our case scenario by first educating Suzanne and her mother of the disease, as well as how exercise can help. Since Suzanne's mother is pre-diabetic, it could be helpful to inform her as well and have her do the same exercise regimen as Suzanne. This implements a supportive community, as Suzanne and her mother can keep each other accountable. To make sure Suzanne sticks to her plan, the goal for exercise would first start at about 15 minutes a day and gradually increase to 30 minutes per day. Starting at 15 minutes rather than 30 would be beneficial, as it is a smaller goal and Suzanne currently does not have any exercise regimen.